Have you ever had a patient tell you that their doctor told them that they have a hole in their heart? Makes you take a little bit of a step back, maybe some question marks popped over your head, and you might have thought to yourself, that can't be right. That absolutely cannot be right. Well, I am here to tell you that is right, and it does happen. On today's episode of Make It Make Sense Cardiology, I am going to teach you about this lovely phenomenon right here, the PFO, patent foramen ovale. What does that even mean? What is its clinical significance? What do we do about it when we find it? All fantastic questions. Go ahead and take your seat, students. Class is officially in session. Now, the foramen ovale, this is a normal part of fetal development. This foramen ovale, meaning a tiny hole, it's not like gaping wide. This is a very tiny hole that is found in the atrial septal membrane. That membrane, dividing piece of tissue that separates the upper right chamber of the heart from the upper left chamber of the heart. You need that. Again, I cannot emphasize it enough. You need this in fetal circulation because this is how oxygen delivery comes from mama to baby. You need that. Now, once baby is born, doesn't matter if it's vaginal delivery, C-section delivery, doesn't matter. Once baby is born and baby takes its own breath by itself, lungs expand, the pressure system of oxygen exchange happens. Like the pressures change in the lungs. We don't need that hole anymore. We don't need it because baby's lungs realize that we can do this on our own. We don't need mommy anymore. Now, once breath is taken, that opening, if you will, should close. Now, it may not close immediately right then and there with the first breath, but sometime in the first few weeks or so of, newborn development, it should close. What should happen if it doesn't? It's not cause for alarm. It's all right. About 25% of the entire world's population lives with a partially opened foramen ovale. That's where the P comes in. P means patent. Patent means open. And it's okay. It is okay. It's usually a benign finding, doesn't cause any problems whatsoever. However, there is a demographic of patients that we need to do some investigation to see if a PFO is present, because it could explain something that happened with them. This demographic of patients are your stroke patients, specifically your cryptogenic stroke patients. What is a cryptogenic stroke? A cryptogenic stroke, and I would be remiss if I did not say this, the terminology is advancing. And more clinical professionals are starting to use the term embolic stroke of unknown source as opposed to cryptogenic. Tomato, tomato, if you ask me, but I'm not neuro and I don't want to be disrespectful. Nonetheless, if you have this patient who has had a stroke and there is no clear-cut explanation as to why this stroke happened, this is where you need to investigate whether or not they have that PFO. Because remember, in fetal development, it's all right because it shunts blood from the right side of the heart to the left side of the heart and, through baby's body and back up to mom. However, in post-fetal development, not the best thing to have because that small opening runs the risk of clots to kind of lodge in there. And again, if the clot does develop, it's going to go to the left side of the heart. And what's the responsibility of the left side of the heart is to give blood to the body. So a potentially formed clot that goes to the left side of the heart can potentially go out of the heart, leave the heart arteries and go up to the brain to potentially cause a stroke. And there's your link. How do you look for a PFO if that's what you suspect? You get a special type of cardiac ultrasound that is called a echocardiogram with a bubble study. Bubble study. What is a bubble study? Bubble study happens when the sonographer is taking their pictures of your heart, and then with the assistance of nursing staff, agitated saline is used and pushed into the IV so that the blood that goes up to the right side of the heart, because that's the input area of blood flow, The blood that's carrying that agitated saline will go up to the right side of the heart, and if a PFO is present, it's going to shoot it right through that hole and then to the left side of the heart, and you'll be able to clearly see that on the ultrasound pictures. Agitated saline, you're probably wondering, what is that? Is that something that's special in the Pyxis? It's not. It is not. Agitated saline just means that we have shaken up or stirred up the saline to the point where tiny little bubbles form in the saline, and these are safe. This is not like a big old air embolus, not at all. Tiny bubbles purposely made in the saline so that, again, you can see these tiny little bubbles flow through a PFO if a PFO is present. And sidebar, student and new graduate nurses, if you are ever invited to participate or help out a sonographer with a bubble study, do it. Do it. You will have a good time. It is, to me, I feel the geek out already. You will have clarity of understanding. It is I just think it's a fun experience. It's nice, to kind of have that little bullet point in the Rolodex of thought of things that you have done, and you'll be able to connect the pieces as far as how things happen. Participate. Accept the invitations to, participate in patient care. It'll help fortify your understanding. That's that. Should you find a PFO in a stroke patient, what do you do about it? Now, there is no blanket statement that says you got to do this if you find this. We don't do that in medicine. We tailor care plans and treatment plans for the appropriate patient. Now, it is entirely possible that PFOs may require surgical intervention. That's not to say all of them. Please don't misconstrue that if you find a PFO or if you're discovered to have a PFO as a patient, that the automatic fix is surgery. That is not what I am saying. I am saying that that is a consideration for some surgery or for some stroke patients. Your specific treatment plan is going to be a discussion between you and your neurologist, you and your cardiologist, you and any surgical team that may need to be involved. At minimum, a baby aspirin is going to be on board. At absolute minimum. Take home point, because I need to wrap this up. I feel myself geeking out. Take home point. PFOs, for the most part, are benign, and they are a normal finding in fetal circulation. PFOs don't typically cause a problem, but PFOs need to be investigated for stroke patients who don't have a pinpointed source for their stroke. Nurses, if you are ever invited to participate in a bubble study, do it. Do it. I promise you, you're going to be like, oh, I see why. I see why she said go ahead and do this. Absolutely. Understanding something that is foreign takes the fear out of it. You can use that in medicine, and you can apply that to life also. Once you understand something that is, foreign to you, oh, okay. It takes the fear out of it. And when you take the fear out of something, you take the apprehension of approaching the resolve out of it. That's all I'm gonna have to say about that. Good lesson today. Appreciate your time as always. Until next time, if y'all have any questions, you want me to clarify anything, I'm happy to do so. Y'all know how to reach me. And FYI, secret spoiler, my book comes out tomorrow, February 9th. Make It Make Sense Cardiology, Volume 1, Foundations and Fundamentals. Grab your copy. Link is in the bio. Class dismissed.